Hey everybody, Jennifer Levine from Jennmed. I am CEO and founder of Jennmed, a company providing education, support, and community for those dealing with various urological issues. I wanted to talk to you today about urinary incontinence or leaking of urine. This is one of two very common secondary side effects after prostate removal or prostatectomy. And I always say, when you are in experienced surgeons' hands, usually urinary incontinence lasts roughly about 6 months. And a Kegel exercise, which is a very common type of exercise that women know, because it's common that we learn this after childbirth, because sometimes we deal with urinary incontinence after childbirth, that men learn this exercise even before surgery, because a Kegel exercise is what is going to help them after surgery to regain their urinary control. And what a Kegel exercise is I always like to tell my patients is that if you're going to the bathroom, and this is, again, just an example. This is not, you don't do a Kegel exercise only when urinating. This is an example. This is how you know that you are contracting the right muscle, is that if you are going to the bathroom and someone walks in on you unexpectedly, you know how you kind of make a muscular contraction to stop the flow of urine because you are surprised. Or if you are going to pass gas, you know how you squeeze because you don't want gas to come out of your behind. So that is the muscular contraction that is a Kegel exercise. When you are urinating, if you do that muscular contraction, you should stop the flow of urine. So a Kegel exercise is an exercise that I want you to know even before surgery, and you can practice these pelvic contractions as much as you can. I always joke with my patients, you don't need any gym equipment or any gym to go to. You only need your mind to tell your pelvic floor muscles to contract in order to do a Kegel exercise. So this muscle, really, this pelvic floor muscle is what is going to need to strengthen in order for you to regain your urinary control. And again, 6 months, if in experienced surgeons' hands, usually is the month, the threshold where I would say that you would be mostly dry. And I always tell my patients that you can track really your incontinence mainly by how much you are leaking day to day, but also track your pad usage. And this is a good thing to tell your provider, how many pads you're using, because this can really, track your overall progress. And I always say, if you are not where you want to be by the 6-month mark, always be an advocate for yourself, because there are other treatment options available. And you should not be miserable because you are leaking urine at the 6-month mark, because again, they have to be an advocate for yourself and look into other treatment options. So again, this is a common issue, but temporary, and I look forward to providing education, support, and community around this very common issue after prostate cancer removal of the prostate for cancer. So again, check out my website, www.jennmed.com, for various products and coaching and consulting services, and I look forward to connecting with you. Thank you so much. Bye-bye.